My background's a little bit unusual, I think, in terms of other Harkness Fellows, in that for many years I was a journalist with the BBC, and then about 10 years ago I left and did a Masters in Social Policy and converted away from journalism and moved into the health policy world and worked for a research foundation in London called the King's Fund, and from there I applied to do a Harkness Fellowship. I think I was really interested to have a chance to do a year's study to get away from the sort of immediate health policy world that I was working in. And it's particularly interesting, of course, to go to the United States, which has so many examples of high quality care, albeit they exist alongside examples of care that doesn't really work very well. But just the sheer scale of the innovation and what's being tried here makes it a very interesting place to come to on lots of different levels. My project was based in Boston. My main mentor was Professor John Ianian, who worked at the Department of Healthcare Policy, which is part of Harvard Medical School. I had a co-mentor, Bruce Siegel, who at the time was at George Washington University, based in Washington, DC. And my interest really was to try and understand how healthcare providers in the United States had used race and ethnicity data to improve the quality of care, because obviously this is a much more diverse country than the UK. You were further down the road in trying to understand how people of different racial and ethnic backgrounds access care and what kind of quality they're getting. And I thought it would be interesting to explore how healthcare organisations used this data once they'd collected it from people. Well, I think I was very interested in the fact that a few organisations, a few hospitals around the country, as well as community health centres and physician groups, had really embraced the idea that it's okay to go and ask people what their race and ethnic background is, that people will give you the information and that will tell you a story. And in some cases they found that, that there were certain groups that were just not coming forward for screening or that were not getting good quality care, and they'd acted upon it. But I was also interested in the fact that they were doing this in a slightly haphazard way, which I think was kind of okay in the sense that they sort of made up their own rules of analysis. They had their own way of applying these data. But, and they were a few passionate people who were really keen on pushing this agenda forward. I think there's quite a big gap between what they were doing and the rest of the healthcare world, but nevertheless they serve as sort of examples of what can be done. Well, the most important thing for me was to get some papers in peer-reviewed journals. So the most important one was one in the Millbank Quarterly, but it also resulted in presentations. I was able to present the findings at a conference in London where healthcare practitioners could come and hear about the examples in the United States. So I think a combination of kind of written outputs and presenting. I think it's just meant that I'm in a much stronger position really to kind of make connections internationally, to be able to kind of draw on the examples from the United States to inform British healthcare policy. I've moved organisations. I now work for the Nuffield Trust. We have quite an international focus, and it's just been incredibly useful really to be able to sort of draw on the insights and also the connections. I think one of the most important things about the Harkness Fellowship is that you make connections with people in other countries, Australia, New Zealand, but more recently other European countries with very interesting examples of healthcare reform, so the Netherlands, Germany, Switzerland and so forth. So I think the connections with others has been a really important feature of the Harkness legacy for me. I think for me, there are many highlights of it. I think the most important parts really were the ones where you're brought together with other fellows in the various sort of seminars and events that are run through the year. So a particularly memorable one is the trip to Washington DC, where you get a real insight in how policy is made. You see how research is used or not used sometimes to make the case for change. You understand how the political process works. You get a visit to Congress, you meet Congress, people who work for Congress. So it's really exciting. You kind of feel that you're at the sort of heart of power. And I think it's a real eye-opener for people to sort of see that, sometimes research can result in a changed perception of the world. So that was a really good highlight for me. Personally, it was a year out from the pressures of work. It's a chance to reflect, you can pretty much chase any idea that seems interesting at the time. You have a project to work on, but you can also follow other ideas, you can make other connections, and it's just the freedom to do that is really, I can't stress how much that is a kind of a valuable thing to have in that year, that freedom to go off and pursue ideas and make connections with other people that you wouldn't otherwise be able to do in your home environment. From a family point of view, it was a really brilliant year, and I can't recommend it strongly enough for people who have families. Don't let having a family put you off applying. I took a 6-year-old and an 8-year-old with me, and my husband came too. And we had the best time. So, you know, although, you know, you're working quite hard, there's quite a lot of travel, but we actually spent a huge amount of time together as a family. It was a real adventure. And, you know, I'm pleased to say that everyone was incredibly nice to us here. They've got very fond memories of the United States. And I think we'll be back when we get a chance to. But yes, bring your family. It works out, and you get a huge amount of support from the Commonwealth Fund, which I really appreciated in all the logistics, you know, and you have a sense that there's someone there to sort of look after you. But yeah, I can't say that it's anything but a good experience bringing your family over. I'd say it was a hugely worthwhile investment. I don't think there's many chances in your adult life to take a year out and pursue something that's of interest to you and make those connections. You know, you have to step outside your normal career, and you know, maybe for some people that might seem challenging, but I'd say it's a risk worth taking. I've yet to meet anyone for whom it wasn't a very valuable year in lots of different ways.